This young male patient is a computer operator and uses the mouse extensively. He had pain over the wrist for 6 months and went to ortho surgeon. Diagnosed as Quervain Tenosynovitis, was given thumb splint and painkillers. There was minimal improvement. He was referred to me. ఏం పని చేస్తే నొప్పి అవుతుంది? కొంచెం మౌస్ ఎక్కువ వాడితే నొప్పి వస్తుందా?
వాడినప్పుడు మరి వచ్చేసి ఎప్పుడు కీబోర్డ్ టైప్ చేస్తాం కదా సార్,
వస్తుంది నొప్పి వస్తుంది.
అప్పుడు వచ్చేసి మూమెంట్ ఉంటుంది కదా సార్.
అవును.
ఇప్పుడు థంబ్ కూడా యూజ్ చేస్తుంటాం.
అవును.
అప్పుడు మూమెంట్ ఉన్నప్పుడు వస్తుంది సార్. ఏమొస్తుంది?
ఎన్ని రోజుల నుంచి నొప్పి వస్తుంది?
అదే చెప్తున్నాం కదా సార్, 4 months.
ఓకే రైట్. There was vague and mild pain over first extensor compartment of the wrist. Finkelstein test was weakly positive. No tenderness over the first extensor compartment. Distal to the extensor compartment, the abductor pollicis longus tendon was thickened and tender. X-ray of the wrist was normal. Carpo-metacarpal joint was normal. Intersection syndrome was excluded as there was no pain proximal to the extensor retinaculum or tenderness. Clinical findings were equivocal. Ultrasound was done. Findings could be A. Tendon thickening of APL and EPB. B. Increased fluid in the first extensor compartment tendon sheath. C. Thickening of overlying retinaculum and synovial sheath. D. Peritendinous subcutaneous edema resulting in a hypoechoic halo sign. E. Pretendinous subcutaneous hyperemia. F. Assessment of intertendinous septum. Though clinically equivocal, ultrasound clinched the diagnosis. This was first described by Fritz D. Quervain in 1895, a Swiss surgeon. Non-surgical treatment consists of A. Splints, B. Painkillers, C. Activity modification, and D. Corticosteroid injection. This patient was advised corticosteroid injection, but he preferred surgical treatment. He underwent surgery under brachial block and tourniquet control. Transverse incision was given 1 to 2 cm proximal to radial styloid. Identification of the superficial radial nerve was done and protected. Then the sheath was released. If the sheath is thick, it is excised. Incision is closed. Later a splint is given. In conclusion, diagnosis of D. Quervain's Tenosynovitis is a straightforward procedure. In doubt, ultrasound is very useful. MRI can also be done in doubt. In this way cases, ultrasound will clinch the diagnosis.